Medical Officer of Health for the province, and Dr. Keith Lehman, Chief Provincial Veterinarian for Alberta. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Earlier today, Dr. Keith Lehman, Chief Provincial Veterinarian for Alberta, and I released a statement to inform Albertans that a confirmed human case of variant influenza A H1N2, an influenza virus typically found in swine, has been detected in Alberta. This currently appears to be one isolated case. It is also the only case of influenza that has been reported so far this flu season. Influenza viruses that normally circulate in pigs, including H1N2, can infect people, although this is not common. While this is the first reported case of variant influenza A H1N2 in Canada, 27 cases have been reported globally since 2005, when reporting became required. All have been linked to direct or indirect contact with swine, and none of the previously reported cases have caused sustained human-to-human transmission. This case was detected in mid-October after a central Alberta patient sought medical care with influenza-like symptoms. The patient experienced mild symptoms, was tested, and then quickly recovered. There is no evidence at this time that the virus has spread further. As part of Canada's obligations under the international health regulations, we are working closely with Alberta Agriculture and Forestry and Alberta Health Services Local Public Health to determine the source of the virus and to verify that no spread occurred. We are also connected with the Public Health Agency of Canada and other partners across Canada to ensure clear communication on this investigation. Retrospective testing of Central Alberta COVID samples from the past 2 weeks for influenza is almost complete, and no influenza-positive samples have been found. Starting today, AHS will also proactively offer influenza testing to residents of parts of Central Alberta if they are presenting for COVID-19 testing at an AHS assessment centre. This testing will be optional and supports our ongoing influenza surveillance in the region. We are taking this seriously, as any human infection with a non-seasonal influenza virus needs to be followed up under our international obligations. I want to be clear, however, that there is no evidence of risk to the public. H1N2 is not a food-related illness. It is not transmissible to people through pork meat or other products that come from pigs. There is no risk associated with eating pork. We are providing this information in the interests of transparency. We will investigate this thoroughly and keep Albertans informed of the outcomes of this public health investigation. While the investigation is not yet complete, I know this has been a long and challenging year, so I wanted to be available in case you have any questions about this case. Thank you, and I'm happy to take questions.
All right, we will go to the phone. Friendly reminder that in addition to Dr. Hinshaw, you also have Dr. Keith Lehman, Chief Provincial Veterinarian, available. Operator, could you put through the first caller, please?
Yes, thank you very much. The first question is from Kendra Slugoski, Global Edmonton. Please go ahead.
Hi, Dr. Hinshaw. Can you just tell us why we haven't seen this strain of influenza in Canada yet, from your knowledge? And also wanted to ask, in terms of COVID restrictions, will we be seeing more soon? I know that you've been pleading with the public, so has Premier Kenney, but the case numbers still continue to go up. Thank you.
Thank you. So the first question about why we haven't seen a case of this in humans previously, as I mentioned, there have been a handful of cases reported internationally. It is quite rare to have transmission of influenza from humans to animals and animals to humans, vice versa. And with biosecurity practices in place, there's very limited opportunity for influenza from swine to transmit to humans. And we also know that when there have been variant cases reported, often in the United States, the majority of those reported over the last decade, they have been very mild and self-limiting illnesses. And so it's possible that there could have been, again, these mild self-limiting illnesses that weren't picked up in the past. But again, when there is a case that's identified, we do have to respond under our international health obligations, which is why we're doing this investigation. With respect to COVID restrictions, of course, we're monitoring our numbers closely and monitoring the impact of the restrictions that were put in place just about 10 days ago. We know that the impact of restrictions does take about 1 to 2 weeks to start to be seen. And so we should be seeing the impact of the mandatory restrictions in Edmonton and Calgary and the new voluntary restrictions in Calgary by mid to late this week, which will help us understand if additional restrictions are needed.
Operator, could you put through the next caller, please?
Yes, next question is Tyler Dawson, National Post.
Hey, I just wanted to ask, obviously Central Alberta, is this linked to a slaughterhouse in any way?
At the moment, there are no links to slaughterhouses, and as I said, we are investigating both on the human and animal health side to make sure that we can understand the source, but there is no slaughterhouse link.
Operator, could you put through the next question, please?
Jesse Wisner, Global TV Calgary.
Hi, Dr. Hinshaw. I wanted to ask about your recommendation for triple-layer masks following Theresa Tam's recommendation yesterday. Has your stance on this changed at all, and is there any intention to redistribute masks to schools and public that are triple-layer?
It's important to know the triple-layer recommendation is specifically for cloth masks, so those non-medical masks, and we have been looking at the masks that were distributed to schools in particular. The vast majority of those that were distributed to school are 3-layer cloth masks. And so we are in conversation about the small number that were the 2-layer and how to manage those. But it is important to understand that with cloth masks, the non-medical masks, additional layers do increase the protection. And so while 3 layers of cloth are now recommended, it's important to remember that it's not a binary. It's not zero protection and full protection. Additional layers add additional protection. And again, the current evidence would indicate that those 3 layers are important. However, I would encourage people, if they haven't yet had time to get a 3-layer mask, to continue wearing the 2-layer while they get the 3-layer. Many of the 2-layer masks actually have a pocket for filters, and so it's fairly easy to put filters in place with that additional layer of cloth, or to purchase the disposable filters that are available.
Friendly reminder that given the time limits, where possible, let's try and focus on the H1N2 case, recognizing there will be a COVID-19 update tomorrow with Dr. Hinshaw. Operator, could you put through the next caller, please?
Kevin Nimick, CTV.
My apologies, I'm going to ask a COVID-19 question. Alberta health stats show we don't know where 2/3 of new COVID-19 cases are coming from. Why then isn't Alberta adding additional restrictions until we know what is causing the spread?
It's important to remember that when you're looking at the new case stats on the website, because the volume of cases we've been seeing every day has been rising, and because when we get a new case reported, of course, a public health investigation has yet to take place. So, for example, when we report later today our new cases for yesterday, those are lab-confirmed cases, but a public health individual has not yet had time to call them and investigate where it came from. So actually, many of those cases, we will be able to determine the source. So instead of looking at the that kind of new case distribution and the active case distribution, we have been looking at the cases where the public health investigation has been complete. There certainly still are proportion of cases, it's about 40%, and that is concerning, where we don't know where the virus has come from. But we do know what the trends are in our own data, and those trends match the transmission issues that we're seeing in other provinces, which are social gatherings. They are times when people are spending time together in close contact, not wearing masks, not using distancing. The issues happen when individuals perhaps are not staying home when they're symptomatic. And those are the things that we're really focusing on. Of course, we are concerned about that proportion that we don't know where they're coming from. However, we have seen a slight plateau, as I mentioned yesterday, in our case numbers. And we will be watching very closely over the coming days to determine if we have been able to start turning a corner with our current restrictions or if more restrictions are necessary.
Operator, could you put through the next question, please?
Janet French, CBC.
Hi there. I do have a question about H1N2 variant. I guess I'm just curious, what scenario was this patient in that prompted somebody to test for flus or look for potential influenza exposure? Tyler mentioned slaughterhouses, but I'm wondering if there's some sort of broader clue that would have prompted the doctor or the medical team to suspect this kind of exposure. And I'm also just trying to get some clarity on what you mean by no sustained human-to-human transmission. Does that mean no human has ever caught this particular variant from another human, or just not many humans catching it from another human?
Sure. So on the first question, part of our regular influenza surveillance program involves testing samples that come from hospitals, so emergency departments or other samples that are collected in hospitals for a range of viruses, including influenza and COVID. So in this particular instance, this patient happened to present to an emergency department rather than a COVID assessment center. And so in this instance, because it was an emergency department sample, it was tested both for influenza and COVID as a part of our routine process. In fact, this individual was recommended to stay home for 10 days, so essentially followed all the instructions that they would have had they been a COVID case, which thankfully are also appropriate for preventing onward spread of influenza. And so, again, in this particular case, there was nothing about the presentation or the history that indicated any different concern than anyone else presenting with upper respiratory tract type infection, influenza-like illness symptoms. But just simply because of the place they presented, again, the influenza test was done. And as a part of our typical lab process, whenever we get an influenza positive, especially early in the season, part of the process is to move through and do a typing to understand what type it is. And as a part of that process, it was identified that it was a non-seasonal strain, which triggered, again, the international health reporting requirements. With respect to the human-to-human transmission comment, what we've seen in these variant viruses in the past is that the majority of them have a direct connection with an animal, and a small number of them have a connection with somebody who's in a household close contact situation. And so the sustained human-to-human transmission, the fact that that has never been seen with this virus indicates that this is not a virus that's known to pass easily from person to person, that again, there have been very few reports of it being passed through that direct close household contact, but not in broad settings, not widely in the community. That's never been reported.
Operator, could you put through the next caller, please?
Yes, the next question is from Colette Derowitz, CP.
Hi, Dr. Hinshaw. I was just wondering, I know that the investigation is still going on, but if you could tell us any more about how this person contracted it, and also if it's connected to any pig farm or processing plant, and how many pigs have been infected, if we know that yet.
So I'll speak to the human health investigation and then ask Dr. Lehman to comment on the animal health side. At the moment, as I said, we are currently investigating, so we don't have a final answer as to where the infection came from. And again, in the interest of transparency and because of our need to follow these international obligations, we didn't want to wait for the outcomes of the investigation to be finalized because that will take a little bit of time. So we are currently investigating that. And with respect to this particular case, following up on the possibility that there could have been some links to different swine farms in that local area, again, simply through that indirect connection of household contacts. And that's what we're following up on. And I'll let Dr. Lehman comment on the animal health investigation.
Good afternoon, everyone. So in terms of the animal health investigation, I think that through information received during the human health component of the interviews that have been done with the patient so far, we've identified some potential sources, and we're continuing to investigate those options or those potential mechanisms. It's not unusual for us to see influenza in our swine populations in Alberta, in Western Canada, and for that matter, around the globe. Within Western Canada, we have routine surveillance that is undertaken for our swine farms, and we tend to see anywhere from roughly a range of 10 to 30 cases identified per quarter. So it is a virus that is not uncommon in our swine populations, and with that, that's pushing us in that direction for the animal health investigation.
Operator, could you put through the next caller, please?
Yes, Brody Thomas, Calgary Herald.
Hi there. Yes, I was just wondering, will there be any special outreach to farms or farm workers in central Alberta or anywhere in the province based on what you know now? Will you be monitoring them or asking them to monitor for flu-like symptoms?
So I think in terms of the workers that are associated with swine farms, that's I think a very common piece of information that they're aware of when they're hired on to work in the farms. That's part of training and things like that. And so I think that awareness is there. Our farms tend to have very good biosecurity practices to outline measures that should be taken both while working in the farms as well as when they depart from the farms at the end of the day to ensure or minimize the risk of taking disease out of the farms and things like that. So I think that nothing specifically planned in terms of outreach on the animal health side and farm workers, and I'll turn it over to Dr. Hinshaw for more on the human health side.
The investigation with the specific farms where there may be a link is, of course, something that local public health is undertaking, and making sure that there is information provided to those individuals, again, about this case. But as Dr. Lehman mentioned, the biosecurity practices are routine, and so the information is being provided as a reminder, and so that they're aware of the investigation. But this case does not change all of those regular biosecurity practices that are in place routinely at all of these settings.
All right, we've got time for 3 more questions. Operator, could you put through the next caller, please?
Barb Glenn, Western Producer.
Hello, a question for Dr. Lehman, if I could. Is this case related to a hog operation, and if so, is there a risk to other hog herds? I know you've spoken about biosecurity, but I'm just wondering if other hog operations need to be worried about this. And if you could also comment on whether this particular strain, is rare in pigs.
Yes, thank you for the question. Let's see. I guess the first thought is that I don't see that there is any increased risk to other hog operations. We know that influenza can circulate within the swine population, and with the biosecurity practices in place on farms, that addresses the risks of moving it from one farm to another. Those practices are really aimed at minimizing those things. And then in terms of H1N2 specifically, during the surveillance, or with the surveillance that we've done over the past years, we've certainly noticed that, I would say over the last 5 years, that H1N2 has become, I would say, a bit more prevalent. But with that said, we still see other strains of influenza in those swine populations as well.
Operator, could you put through the next question, please?
Rod Nickel, Reuters.
Hi, Dr. Lehman. Just to add on to Barb's question there, can you describe what mortality risk there is to hogs if they catch this? Like, is it, maybe just put it in some perspective related to the other, major viruses that are ravaging hog herds around the world?
Sure, that's a great question. Typically, when we do have influenza in our swine populations, it's actually not even uncommon for it to be in a herd and not show any signs of clinical disease. But when it does show up, typically it's pretty mild, similar, I would say, to what we would see in humans. There's some mild respiratory illness that can happen. In rare occasions, we can see some abortions that will happen in sow herds, but generally, the illness is very mild, if any, present at all.
All right.
Thank you.
Operator, could you put through our final question, please?
Adrienne Williams, CBC French.
Hi, thank you. My question was already asked.
All right. Operator, could you put through our next final question, please?
Catherine Krigowski, Alberta Today.
Thanks very much. Dr. Lehman, I'm hoping you can explain a bit more just quickly about those biosecurity measures. So when there is a case of H1N2, does that mean swine cannot be moved from farm to farm or to a processing facility, or what happens if there's a case on a farm?
So typically in our swine industry, we have, I would say, fairly limited movements. Lots of the industry will have, all the production happening within one facility. That would be denoted as a farrow to finish type of operation, where the piglets are born on site and raised up right through to their finished state. But typically, there's just not a lot of movement of pigs, I would say, between farms. And then, again, in terms of the biosecurity practices, it can vary depending on the type of operation, but you'll see anything from a range of changing clothes and changing footwear when you go in and hand washing, right up to, a full shower in, shower out type of facility, where that also includes a change of clothes, obviously, but...
All right, thank you all for joining us. It was a very full queue, so if you have additional questions, feel free to direct them to either Alberta Health or Alberta Agriculture and Forestry for follow-up. Thank you, and have a great day.